Welcome to this session on constructing scenario-based questions. I think you've already gone through the basics of how to construct MCQs. And today we will specifically look at how to construct scenario-based questions, both for MCQs and for the longer questions. So what we'll try to do is at the end of the session, we will try and hope that you will appreciate the need for these kind of scenario-based questions. Next is we'll try to describe the basic rules of constructing scenarios or vignettes, and then we'll give you some tips and tricks to convert factual questions into application-based questions. Before I begin, I'd like to acknowledge that most of these questions are taken from published articles or item writing guides, and they are not my original questions. And I thought they were good examples, and therefore I've taken it from those resources. Now, I'd like to begin by giving this message that quite often we focus on the format of an answer. We try to think about what kind of a format should a student answer in. Should he or she give you an MCQ or a SAQ or a LAQ? But we always forget what is the format of the stimulus. And by stimulus, we mean what is it that the question expects the student to answer? Or rather, when you ask a question, what kind of thought processes go through the mind of a student? So all this pertains to the content of the question. It does not depend upon the format or whether you're asking an MCQ or an SAQ or an LAQ, but it depends upon the content and how it triggers different thought processes in the student's mind. So the message I want to give here is that the stimulus matters. And when you say stimulus, the stimulus can be of two types according to this article by Schuwerth and van der Vleuten, which says that questions can be either context-free or context-rich. Context-free questions are questions where factual knowledge is usually tested, and the considerations are simple, that we look at whether they can recall some usual knowledge there. So, and if you have options given in an MCQ where you ask for facts, we expect students to recognize the correct answer. So in a sense, it is A, B, C, D, and each of them is a true-false question. Is it true for A? Is it true for B? Is it true for C and D? So that is a context-free question. When you talk about a context-rich question, here the question is directly related to a case scenario or a patient. And what we are trying to do here is to ask the student to reason. So candidates will weigh the different information, the different units of information that you're providing them in the clinical scenario, and then make a decision. So they are applying their knowledge. What you need to remember is that the thought processes invoked by context-rich questions are completely different from those in context-free questions. So what you ask will determine the way students will study. If you're going to ask more of context-free questions, the way students will study is going to be superficial, there'll be surface learning, and they will go in for more recall type or rote learning. If you're going to ask more context-rich questions where they have to apply their knowledge, the kind of way they're going to study is going to be deep learning, where they will learn to apply their knowledge to a particular clinical context. So I hope this makes it clear why scenario-based questions, which are context-rich, are important. So the basic message here from this paper is that it is the content of the question rather than the format which determines almost totally what the question tests. So give a lot of thought into what you want to test. Now, how do these scenario-based questions help us? Now, as doctors, we make decisions on clinical scenarios every day. This could be related to diagnosis, to investigation, or to management. Now, these written clinical scenarios try to recreate real-life situations. And therefore, when something mimics real life, it means that the validity of the question is high. The content validity is high in the case of scenario-based questions. So usually when it comes to writing questions for clinical subjects or even for pathology or microbiology where there is a clinical link, it's easy to write those questions because usually whatever you're doing is applicable to the clinical scenario. However, when it comes to basic questions, it is a lot more difficult to write scenario-based questions. And I am going to focus today more on how to write questions which are scenario-based for the basic sciences than on the clinical sciences. So first, there are people who will ask you, why is it essential to have scenarios in basic sciences? Now, we are talking about contextual learning, and therefore the working knowledge of basic sciences is important, and it must be essential knowledge for clinicians. So unless you know why something happens and causes a disease, what is the mechanism behind it, your learning is going to be very superficial. So you have to look at situations where knowledge of basic science was a key to a successful clinical outcome, where a doctor could not have made a diagnosis without having an understanding of the basic science. So pick up those scenarios and then use them as questions, and that is how you can use scenarios in basic sciences. So before I go ahead, are there any questions when we'll talk about specific uh, tips on how to write scenario based MCQs? Are the basics clear so far? If there are any questions, you can please unmute yourself or raise your hand, and Neha will help you to ask the question. Or you can use the chat box. Are there any questions? Because I can't see. Yeah, I can't see any hands. So I'm going ahead. So here are some points to keep in mind when writing scenario-based MCQs. So 1 second. So the first important tip here is always pick up common and important topics from routine clinical practice. People have a tendency to go and pick up syndromes and exotic questions, and these are not suitable for asking scenario-based questions. These scenarios need to come from your local surroundings. These scenarios have to be with what you do in day-to-day practice, and scenarios are best when they reflect real-life practice. Now, whenever you sit down to make scenarios, the first important thing is to make a blueprint. Ask yourself what diseases you want to ask about and which aspects of these diseases you want to talk about. Do you want to talk about basic science principles? Do you want to talk about diagnosis, history, prognosis, complications, treatment, management? What do you want to ask? So first of all, make a blueprint and ask yourself what concepts you want to test. Once you decide what are the concepts required for that level of the learner, then framing scenarios according to that concept becomes much more easy. So this is a step you should not miss. Otherwise, when you have to make 20 questions, the first questions are easy and then you become very frantic, and then you open up some MCQ books, and what you end up is with lots of syndromes which are not uh, common in your local context, and it makes no sense to ask students questions which they are not going to apply. So to be on the same page, let's first, I think you know all this, but let's go into the different parts of a clinical scenario or a clinical vignette. So this whole paragraph, which carries the uh, history of the patient, is the clinical scenario or the vignette, and this is called the stem. The sentence which leads to the options is called the lead-in. So which of the following is the most likely diagnosis is called the lead-in. The options is a set of options. The correct answer is called the key, and the remaining options are the distractors. I'm sure you're familiar with this because you had lots of sessions on MCQs early. So these are the parts of a clinical scenario. Now you've heard this rule, I hope, for the MCQs. For any MCQ, the test of an MCQ is to use the cover test. Now, what is the cover test? In case you have missed the previous talks, this is a question which they asked in yesterday's KBC. So this was a question. Now, suppose I covered the options. If the options in this question were covered, so the answer to this question would still be obvious even if the options were not there. So this is a good question, a good MCQ. A good MCQ is one which is answerable even when the options are concealed. So use this test for any MCQ. One should be able to answer the item based on the stem and the lead-in alone. Okay, so this is an important thing to remember. Always use this test because otherwise there is problem with the grammatical errors, or there are cues in the question which there can be flaws, technical flaws in it. Or otherwise, if you need to look at the options, it means that there's simply a set of 4 true or false questions and the person has to recognize the answer from the remaining. So it's not a question based on knowledge, rather on recall. So I'm going to give you another test, which is the cover test for scenarios. Now suppose there is a big scenario here. I haven't bothered to write it down. And suppose you block this scenario and the lead-in question is, what pancreatic secretion is predominantly responsible for fat digestion? Okay, so the answer to this question is obvious even if you don't read the scenario. Is this point clear? So what you're asking in this lead-in question is just the recall of a fact. And this scenario here, irrespective of what it is superfluous, it is redundant. You don't need a scenario at all in this question. And then the student feels they have wasted their time reading the scenario when the question is quite obvious from reading only the lead-in. So this kind of a scenario is a bad scenario. So in a normal MCQ, you would cover the options. When creating a scenario-based MCQ, I would suggest that you cover the scenario, leave the lead-in, and see if the lead-in gives the answer right away. If the lead-in gives the answer right away, it means it is not linked to the question, it is not linked to the scenario, and therefore the scenario is of no use. Instead, if after reading the scenario, you ask the question, secretion of which pancreatic enzyme is most likely to be impaired in this scenario, then you are now asking for application. So I hope this concept is clear now. I'll give you an example. Suppose you have a basic science question where a 32-year-old man with generalized weakness had a biopsy taken from his quadriceps muscle. And this biopsy was examined using an electron microscopy, and the pathologist reported an abnormal appearance of the Golgi apparatus. And the question is, what is the main role of the Golgi apparatus? And these are the options given. Now I'm going to use the cover test for scenarios, which means I'm going to cover the scenario. Now, even if I don't see this scenario, the question simply is, what is the main role of the Golgi apparatus? And I can still read all this and give my answer, that is C. So in this case, the scenario is redundant, and it makes no sense to have the student waste his time reading a scenario when the answer is quite clear from the lead-in. So simply adding a clinical scenario to a basic science question does not automatically make the question clinically relevant. So it's important that a clinical scenario must be essential, meaning the scenario should make the clinical relevance of the area being assessed explicit. Otherwise, it's going to look artificial or contrived, and no candidate wants to read unnecessary material and waste their time in the examination. Now, how do you make the scenario essential? Like the same question, I've reframed it as a 32-year-old man with generalized weakness underwent a muscle biopsy that identified an abnormality of the Golgi apparatus. What cellular function was most likely to be abnormal? It's asking the same question, but just by covering the scenario and reading what cellular function was likely to be abnormal, you cannot make out the question. It is now, you have to read the scenario and then apply your knowledge here to come to the question, to get to the answer. So scenarios need to be essential. They need to be integral to the question, and they require candidates to apply their knowledge specifically to it. Any questions so far? You can unmute yourself and ask the question. Or use the chat function. I don't see any hands. Okay, let's go ahead. The next important tip is that each question, each item should assess the application of knowledge and not the recall of an isolated fact. When you're using a scenario, use it for application. Don't use it to recall, see whether students can recall an isolated fact. Now, to give you examples, this question, I'm just talking about the lead-ins here. If after giving a scenario, you're saying, which of the following is, so you're asking them to recognize from a list of options. If your question is, what is the reason, then you're asking them to recall from it. But if you're saying, in this patient, the most appropriate treatment, management, whatever, or diagnostic, so here you're asking them to apply. Now, you can use recognition and recall, but it depends upon the purpose. If it's a low stake examination, like a unit, once you finish a chapter or a unit and you're asking questions, in that case, for the formative function, you can use recall questions or recognition questions, right? What you can do is, for the high stakes examination, you are looking to distinguish between the good students and the not so good students. In that case, preferably all questions should be application based. Is it clear? Right. So how do you make basic science questions clinically relevant? Your question can be, the factual question can be, what enzyme is most likely to be deficient in cystic fibrosis? Now, this is a straightforward recall question. I can transform this question into a clinically relevant question, though it is difficult in a basic science. Like, a 2-year-old boy was found to have cystic fibrosis. The parents had come to ask the doctor how the disease happened, and so what is the enzyme deficiency that was most likely mentioned. But this is one way of transforming a question, like somebody is asking the doctor a question and he's explaining the mechanism. So that is one way. Or sometimes you can say that the patient itself is a doctor or a scientific person and wants to know the basis of the disease. So those are situations where it is necessary, where it's very difficult to ask about a mechanism. So you can use that kind, but don't use that kind of thing too often or it will look very artificial. Now, there's this study by Case, Swanson, and Becker, where they have studied around 56 different questions, where each question was used in a non-vignette version, a short vignette version, and a long vignette version. So a non-vignette version is where a question is asked without any clinical context, like in adults with myoglobinuria, what is the likely cause of renal failure? A short vignette question is where specific 2 or 3 facts are given, not too much detail. Like a 40-year-old man passed reddish brown urine after completing a marathon 2 days ago. He now has oliguria with azotemia. What's the likely cause? So the direct questions are given, like the patient has azotemia is already mentioned, that his past reddish brown urine is given. A long vignette is where a lot of details are given, some relevant, some irrelevant, and the student will have to sift out what is important here. So a 40-year-old man has decreased urinary output. Instead of oliguria, they have talked about decreased urinary output since he ran a marathon. Immediately following the race, he passed scant amount of reddish brown urine. Physical examination is normal. Serum creatinine and blood urea concentrations are given. This means the student needs to know what the serum urea and the blood urea nitrogen values, normal values are, and they have not talked about azotemia directly. The student has to figure out from the student that the patient has azotemia, and the options for all of these are the same. Now, when they studied this and said what is the difference between using different versions of the same question, they found that the difficulty level obviously increases. So while most students got this question, the answer to this question correct, as you move from a short vignette to a long vignette, the difficulty level increased. However, although they expected that as you move from non-vignette to short vignette to long vignette, the ability to discriminate between good and not so good students will improve, they could not find um, good evidence that this happened. They had some questions where this happened, where the long vignette version uh, was gave a better indication of a better student, but not in all questions. So this was not uniform throughout. This paper is important because they talk about the advantages of using scenario-based or vignette-based questions. So the important thing is we still, in spite of not getting clear-cut evidence that it helps to discriminate, we will still speak in favor of vignette-based questions or scenario-based questions because vignettes can identify students who have simply done rote learning or simply memorized something from those who can actually use that knowledge effectively in clinical practice. So when you're going to use more of these clinical vignettes, they encourage students to learn differently and go beyond rote learning. So if the students know they are going to get this kind of questions, um, they make students learn differently, and they make students integrate their knowledge and apply it to a wide range of patient situations. And we've already said that this improves the content validity of examinations as they are very close to the real life situations. So I would now, I think we've already must have seen this in the when designing MCQs. The lead in which you're talking about, the question which leads to the options, that should be a single question, a single statement. It should be a closed question and very clear. So it should be, which of the following is the most appropriate step in management? So it should read alone. So don't use open-ended questions like the diagnosis in this patient is. So because here the technical flaws are a problem. So it's best to have a question which is closed-ended and which reads alone, which is a standalone question. I'm giving you some examples of how you can use scenarios in the case of basic sciences. Like in anatomy, you want to know the relation between different structures. So if I want to know ask a student, if I want to find out what the uh, excuse me, what the structures behind the stomach are, I can ask a question like a 67-year-old man underwent laparotomy for abdominal pain, and he was found to have a gastric tumor eroding through the posterior wall of his stomach. So what adjacent organ was most likely affected? So it's the same question, but you are now talking about a person with a tumor which is going through the posterior wall, and if the student knows what the structures behind the stomach are, he will know what organ is going to be affected. Similarly, you can talk about a person who was stabbed in his right upper arm, and after the stabbing, he has numbness over the dorsolateral um, aspect of the hand, and which nerve is most likely to be affected. So if the student knows which nerve supplies the dorsolateral aspect of the hand, they can answer it, but now you are applying that knowledge here. Similarly, in histology, you can, because the students in histology know only normal, you can say that the person had a liver biopsy which was normal. Then, because now we have options to have images, you can write about what structure does the arrow indicate.
You can write your questions in the WhatsApp group also.
Okay, so we can now go into the physiology. So again, you're in first year and you want the student to know about normal function, but you can use a disease like saying a 25-year-old woman developed renal failure, and the doctor said that the damage to the kidneys proximal convoluted tubule had impaired one function. So indirectly you're asking what normal function is most likely affected. So if the student knows what is the function of the proximal convoluted tubule, they can answer this question. So you need to use the application to ask about what the student must know at that year. Don't ask questions about disease in first year. You are going to ask questions about basics, about normal. Again, the same question, the same woman, maybe you can say she had renal failure, but then her blood test says that her GFR, her glomerular filtration rate, has fallen by 90%. And what is her best estimate of her filtration rate? So if the student knows what the normal GFR is, they can say 90% fall means now what? They can calculate that part. Now, it's very difficult to write questions related to biochemistry or molecular biology because here you have pure reactions going on. So you need to have a disease which discusses the normal function or the absent function. I'll give you one small example. If let's look at the left side. Um, Suppose you want to ask, lactase is an enzyme which breaks down lactose into glucose plus something else. So this is a direct recall question. Now this, you have to use your brains and be a little more creative and say, an 18-year-old woman had lactose intolerance. A dietitian advised her to add lactase to fresh milk several hours before drinking it, and then explained that how lactase works. It breaks down the lactose in the milk into glucose and another sugar. What is the other sugar? Okay, so you have to be a little innovative, a little creative, use your creativity here, and then it's possible to use to convert factual things into clinical scenarios, and anything which is purely factual and not applicable need not be asked in a scenario. If something is so important that it has to be in a scenario, use it. Otherwise, if the fact is so important, you can put it into a SAQ or something else. Don't put it into a scenario based question. Now, this is from the Nbme item writing guide, and these are some useful lead-ins for basic sciences. You can go to the Nbme site and you need to put in your email ID and then you are allowed to download this. Or I think Sanjay has already put this up in the resources in the classroom. This is already there, but this is the new version, the 2020 version of the item writing guide has come over there. So the questions which you can ask in basic sciences are, which of the following is the most likely cause or mechanism? After this after the scenario. You give a scenario and then this question. Which of the following is the most likely infectious agent? What is the most likely explanation? Which is the most likely location? Which is the most likely pathogen? In this investigation, what substance is most likely to be increased or decreased? What is the biopsy most likely to show? Deficiencies there in which enzyme, which cytokine? So these are questions you all can understand. So these are the questions you want to ask, but have a scenario to which the student will be referred to, and then he answers the question. So like in pathology, you can answer this question where you are giving the age of the patient, a 10-year-old girl, the symptoms across hematuria for 14 days, a past history of sore throat, you have a BP which is raised, then there is edema which is 2+, then you have the nitrogen which is raised, and what's the most likely cause. So based on this, the clinical scenario allows you to apply knowledge of the answer to see this happens in a young person, hematuria plus azotemia. So what is happening? So this is how you allow them to learn in a contextual manner. So they're not learning isolated facts, and now they're learning to apply. At least in second year, they will have to start making these links in their brains. So just like that in Pharmac, I've tried to put examples of every subject as far as I could. Like in Pharmac, a simple recall question would be, which of the following medications is used to decrease preload in systolic heart failure? Now, this is a direct recall question, but if I want to modify this into a scenario, the advantage is I can create a scenario which is different for systolic heart failure. The systolic heart failure can occur in an old patient with an ischemic heart disease, or I can have a scenario with a young patient with viral cardiomyopathy. So you can frame a question, and therefore the pharmacological impact can be changed here. You can put in a complication where the drug cannot be used. So those things of trying to apply a drug to some situation where it might be contraindicated in that case, why some drug is better than that, these kind of applications can be assessed using scenario-based questions. Now, one important thing to remember is that the details of the clinical vignette should be guided by the level of the student. Now, one good place to get your scenarios is from real life. So if you have a patient and you encountered a patient, this is the clinical problem, you can convert that into a scenario. But while doing so, remember the level of the examinee. Now, if it is a MBBS student, undergraduate student, it's important to use very typical clinical features. In real life, you will have complicated cases and complex cases. So remove out all the complications and keep the case as straightforward as possible. So if I want to talk about heart failure, I will simply talk about shortness of breath, which improves with rest, which uh, increases with physical activity, or I can say about PND, that is, he's getting up in the night with shortness of breath, and if he sits up, he's feeling better, or I can say he's not got chest pain. So these are typical features. I will not complicate them with using what are called red herrings, where I will not want to divert the student and confuse the student in a undergraduate. In a postgraduate student, where I will expect them to handle complex and atypical questions, scenarios, I will include some atypical features from the actual history. So depending on the level, so here, even if it is, I'm talking of shortness of breath, I can add in wheeze, which means the patient already has a diagnosis of asthma and then he's now got heart failure. So I can include more complicated cases in case of a senior student, but in case of an undergraduate, I will keep the scenario as clean as and as less confusing as possible. Now, how do you use clinical vignettes? One is you test application of knowledge in real life situations. Now, which situations? I said this before. Focus on common situations or potentially catastrophic problems. Things which, if a student does not know, will kill the patient. So, those are scenarios that you have to know. Avoid zebras, avoid very exotic things, avoid syndromes, avoid things which are common in the West. Talk about things which our students will encounter in our practice, in our scenarios. Okay. Now, when you're framing a question, you may frame a question which can be handled by a specialist. But what is the decision that the student has to do must be at the level of the student. The scenario might be something that comes to a clinician. But if the student is expected to know the next investigation to order, ask the student at that level only about investigations. If at that stage the student is not expected to manage the patient, don't ask management. So the lead-in question will pose a clinical decision-making task which is expected from that level of the student. Focus on specific tasks that the learner must be able to undertake at the next stage of training. And one good place to get clinical scenarios is that you focus on areas where students often make mistakes in clinical reasoning. So you know the areas where people always get confused, people get their diagnosis wrong or the approach is wrong. And these are opportunities for you to correct these by asking these in the form of scenario-based questions. So this is a general template for any patient vignette. You have the age, gender, the site of care, whether it's an OPD patient or emergency patient, what the presenting symptoms and duration are, what the patient history is. You can ask past history, family history, psychosocial history, physical findings, investigation results, and all that. All of these need not be there in the same scenario. You can use whatever is pertinent to your scenario, but always try and go sequentially and logically. Don't jump around the bush. So when you give a scenario, start with age, presenting symptoms, and then go on in a logical sequential fashion. This is one clinical vignette. Even if you don't read it, it doesn't matter. I could have simply asked a question saying, what is the most appropriate treatment in a case of venous thromboembolism? But that's simply recall. So if I'm saying that this woman had a long flight from the UK for 10 hours and after that she has shortness of breath and pain in her leg and she's not taking any oral contraceptives, this scenario the student must be able to recognize as this one option is venous thromboembolism. Now you can ask a number of questions on this scenario. You can ask about the diagnosis, you can ask what the next test to order is, you can ask about the next step in management, you can ask about the mechanism, what happened in the flight, why did this thing happen, or the appropriate treatment, or what, because depending upon that mechanism, what is the treatment that you would like to give. In the Nbme guide, you have these lovely questions which are the possible lead-ins for clinical questions. I suggest that you open the guide and look at these questions and you will be able to frame a number of questions like, obtaining and predicting history and physical examinations. So based on the history, what is her risk of developing this condition? Um, what is the additional information that you want to ask now? What physical examination would you like to conduct now? Or selecting or interpreting diagnostic test. So you can give values and then say which of these lab diagnosis, which tests are important to ask now, and why is this value raised or why is this value less? What is the reason, explanation for this? Or what is the likely diagnosis? Or the prognosis and the outcome, like what is the likely complication or which complication will this patient develop or what is the prognosis? So I think these are things that you already know, but having a checklist in front of you allows you to frame more interesting questions and more varied questions. Any questions so far? Because I've finished with most of the scenario-based questions. If there are any questions, then you can go ahead otherwise.
Please, you can unmute yourself, write in the chat box or write in the WhatsApp group. Neha, can you unmute those who have raised their hands?
Yes, sir. Sir, but there are still no raised hands, sir.
Okay.
There's something in the
Sir,
chat.
there
Let
is
me
a
look at this.
question in the chat box.
Yeah, I'm just reading it out. A 29-year-old Bhavna is asked. A 29-year-old female patient comes with neck swelling, which moves on deglutition. She complains of palpitations and increased appetite. All of the possible structures may be possibly be compressed by this swelling, except now. I've given you a number of cues now. Can you tell me what can be improved with the lead in here? I think Sucheta has given that. Try and avoid except. But in a scenario based question, I want the lead in to be closed, not open ended. So the moment you feel like writing except, you can what should I say, curtail that urge to write except by saying which of the following structures may be compressed by this. Have a direct question rather than having except questions. Okay, is it clear, Bhavna? So if you improve the lead in, the rest of the options also become good. Okay, so how does the student have to use the scenario to answer this question? Just by knowing that the thyroid is moving with deglutition, that's it. The palpitation and the increased appetite are something which is not relevant in this case, isn't it? Do you understand my point, Bhavna? You have written about palpitations and increased appetite, but all you are asking is about this swelling which moves with deglutition. So if this is for a first year student, I understand, but even there, you need not include palpitations and increased appetite.
I thought that will give them more clue because these are just first year anatomy students. So that was the whole.
So you can say that the next swelling is an enlarged swelling. Make it a goiter. Okay.
Yeah.
Enlarged swelling, which is
Okay. Okay.
and some whoever's voice. Please mute yourself. There's lots of disturbance. Okay. There's another question. Okay. I see another question from Vijaya. Is there any way in which a student can be trained to write case by? Yes, they can be trained to write case by scenarios, but in the clinical years, if you're going to ask them to write case-based scenarios in the first year, they will not have that much knowledge. Okay. Case-based learning and problem-based learning is a completely different issue. We are talking about assessment here, and these are learning methods, teaching learning methods. This is not something which we will discuss today. And case-based learning is not what we're talking about. We're talking about writing questions for assessment, and this is completely different from case-based learning. Are case-based questions better than essay questions? It depends upon, I told you that right at the beginning, that the format does not matter. It doesn't matter if you're going to ask an MCQ, an SAQ, or a LAQ. What matters is how it stimulates the brain of a student. So whether you're giving a context-rich question or a context-free question is what matters. as long as the question is context rich, the learning will be contextual. The student will be forced to apply their knowledge. Where questions are direct and context free, they simply end up with rote learning. Any other questions? Okay, so I'm going ahead. Um, So now, because we have online assessment, use it as an advantage, because now you have even your online examinations. They all have facilities for having computer-based examinations, which means you can use images. So images, you can use ECGs, you can use X-rays, you can use USG findings, CT scans. Any of these imaging results can be used. You can use patient photographs, but when you're using patient photographs, remember to maintain patient confidentiality. If not necessary, do not click the patient's face, and if you have the face, then at least see that the patient is not identifiable. And whatever image that you're using, it should not be you should not be able to trace it back to the patient. So that kind of metadata is important. Whenever you have videos, there are copyright issues also. So create your own videos. Some important tips: keep the video short, around 30 seconds, not more than that, because then the student doesn't have time to see a 60-second video and then come to it. So videos can be done for showing neurological signs or tests and showing clinical findings. That can be done as some type of gait, or maybe this video showing Parkinsonism, or you can even have professionalism videos or communication skills videos, very short videos, like a person asking for informed consent and what mistakes that person made. So things like that can be done. Make your own original videos, but when you do that, try and keep a blank background so that students are not able to identify where this was shot. So if there is a proper instrument or a different colored wall or something, or a board somewhere, they're able to identify it. If the patient is wearing a peculiar clothes, it should not be tracked back. So preferably, if the patient is wearing an OT hospital gown, that's difficult to identify. And again, there, if not necessary, do not focus on the face. Uh, then there should be nothing which can identify it. Like even the clinician is best not seen. So make sure that confidentiality is maintained, because if these videos carry ahead, the patient confidentiality may be compromised with. And always, whenever you're going to use videos or images, you need to have a signed consent form from the patient saying that I'm allowing my images to be used for teaching purposes or assessment purposes. Of course, you know about sound files. You can use heart sounds or breath sounds. These days, when online, you can have interactive media, like you have this kind of picture, and if you move your cursor like a stethoscope towards this sound, and you can hear different heart sounds, and you can have questions related to that heart sound there. So these kind of interactive media are also available. Now, once that you have created your scenario, it's important that you step back. I mean, I know everybody is very passionate and feels their questions are perfect, but step back and review the question. It's best if you give it to one of your colleagues and ask them to review the question, because we are so involved in making those questions that we cannot see the flaws in the question ourselves. So review the question and see whether it follows a logical sequence that I talked about. Does it go from patient demographics and then history and then physical examination, then the lab findings? Whether the content is appropriate for the level of the examinee, whether the question is clear. Are you having extra red herrings in that which are confusing the student? Is it confusing between two different diagnoses? Is it unambiguous, the question? So those are things you'll have to review. Now that we've talked about scenarios for MCQs, I'll just, because we've already done this before in LAQs, I'll just talk about framing scenarios for structured essay questions. I'm not going to details. Instead of having a long answer question, you can use a scenario and then ask supplementary questions to that. Now, the advantage again is that it is contextual learning. So this is a pathology question. So you have a 15-year-old girl with symptoms of joint pain in her right knee, and she gives a history of pain in her elbow. So it's the joint pain which shifting from the right knee to the elbow, and then then it resolves on its own. There's a history of sore throat, a past history, and then that she has a pericardial murmur. So rub. So what are the possible causes? What investigations would you like to do? Describe the expected gross and microscopic findings, and if left untreated, what are the complications? So these are all questions which I expect any student in pathology to know. But instead of just saying, write an essay on rheumatic fever with the gross and microscopic findings, I'm asking it based on a question. Now, when you write a question like this, be careful about some things. One is, if the student's first answer is wrong, it's quite possible that because the questions are linked, the students, all the answers of the student will go wrong, and it's unfair. So try and keep the questions fairly independent of each other. The other thing is, if suppose you give a question, some information here in the last question, which gives a cue to the other questions, the student can go backwards, and even though he didn't get the diagnosis here, from this he might go and find out here. Like I'm saying here, the patient's heart. So this itself is giving a cue that this is something to do with the heart, right? Why are they asking the heart? So sometimes you can't avoid it, but the latter questions may provide clues to the previous ones. So try and keep the questions reasonably independent of each other. It's a little difficult to write. And if required, additional information can be disclosed in the later questions. I remember I corrected a paper in some university, and there was a hematology question, and the question was not framed well. The student got confused whether it is megaloblastic anemia or it was an anemia, but he could not make out whether it's an megaloblastic anemia or an iron deficiency anemia. The poor student, for a 20-mark question, wrote both and used a pencil to slightly cut out one. So it was always saying, I'm not using a pen to cut it out. So if the second one is right, please take that answer. So you should make sure that your question is clear, unambiguous, so students don't get confused like this. So with this, I would like to end by these take-home messages. And the take-home message is that what you ask, the content of the question, is more important than the type or the format of the question. The kind of thinking process or stimulus that the question will evoke in a student's mind is more important than the format of the question. So what you ask will influence the way a student learns, whether it is deep learning or surface learning. So you hold the reins of how a student learns in the way you ask questions. So please take this seriously. It takes a lot of effort to make these questions, but if you have a question bank with these questions, they'll be useful for all subjects. I know people where they have question banks for the entire institute together, and the same scenarios. By changing the lead-in question, you can use the same question for pediatrics or pathology or anatomy. So you can change the same question just by changing the options if the scenarios are well. So thank you.